I really think that what stands out for AMN is its people. They really make it seem completely seamless, as if they are just another department of Emory Healthcare. They really get embedded in our culture, in our organization, and really make it seem like we're in this together. What I'm looking forward to the most is the integration of everything that's happening in the technology space with AI, etc., and how we can bring that into the healthcare system where we can put the humans closer to humans. It's really fun to be able to co-create. AMN went above and beyond to support Emory Healthcare a couple of months ago when we acquired those two other hospitals. We were in a complicated environment. We really had to be mindful about the clinicians and, of course, patient care. We didn't want any disruption. Healthcare is 24/7, and especially during a transition. They didn't just leave after the transition. They kept checking on us, and they were nothing but flexible during this time. And it made the entire crisis feel a lot lighter. And that is because AMN has the experience and ability to manage these types of crises. The support and communication throughout the partnership have been outstanding. The responsiveness, it's something that I'm not used to from a partner or an outside company. We have been able to decrease contingency contract labor all throughout our partnership. AMN really has the same vision that we have. They have the same ownership in our goals and the ability to make things happen for us and with us. They are inclusive in everything we do, and that's why we're able to accomplish everything that we set up for. If I were giving advice to any healthcare leader that's looking into a solution based for their workforce, I would really advise them to look at the relational aspect of that organization and truly looking at the people more than the processes, because the people are the ones that make or break a relationship.